Good evening, everyone. I welcome to the webinar to this Heart Lung Transplant education sessions. I'd like to introduce the guest speaker for today and the moderator of the session. I am pleased and honored to introduce our guest speaker, Dr. Swarnalatha Madam, a practicing nephrologist from NIMS, Hyderabad, in charge of the Jeevandan program in Telangana. She has been an architect of the Jeevandan program for Telangana and has been inspiration to everyone, a hardworking, dedicated lady to her job and profession, brought a lot of reforms in this program, along with a lot of training to the coordinators to make this program a grand success. Welcome you, ma'am. And I'm also pleased to introduce our young dynamic moderator, Dr. Giridhar Hariprasad Garu, a dynamic cardiac surgeon, trained at Auckland, New Zealand for heart lung transplants, and has done his FRCS from Edinburgh. Joined us Yashoda recently, a dynamic surgeon. Welcome, sir. I'd like to moderate the session today with, I'd like to invite you to moderate the session for this evening. Good evening, sir.
Thank you, sir. Welcome, sir. Thank you for that warm welcome, and good evening to everyone on this to this webinar on organ registry in India. Thank you, Madam Swarnalatha, Madam, for accepting to speak to us and enhance our knowledge about the organ registry in India and especially in Telangana. Madam, I would request you to just go ahead and start off your presentation.
Yeah, thank you, Dr. Giridhar sir, and then Dr. Ravikanth sir. And I would like to thank the Yashoda group of hospitals also for providing this the opportunity. So before
Hello.
I think ma'am has got interrupted. So you continue the discussion. I'll check with the ma'am.
Madam has come back in. Yeah.
Ma'am, you need to unmute yourself.
yeah, am I audible now?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
And I think this process, I lost my slides. Again, I have to upload my slides, I believe. Just a moment. Yeah, it's visible now.
Yes, ma'am.
Yes, ma'am.
Okay. So, I'm sorry for the inconvenience, and I would like to thank once again for giving me the opportunity. So, I think this is the need of the hour to talk about the organ registry in India and what is the status of organ transplantation in India and in our state. So, here am I to talk about this. So, I think when you talk about the organ registry, particularly with respect to a global scenario, so there's one organization by WHO that's called as a Global Observatory on Donation and Transplantation. It gives us the entire picture of what is the status of organ donation and transplantation across the entire world. To look at the figures, it's more like in lakhs. The individual organ transplant, organ transplant, 1,44,000, and it also gives us what is the organ donation status across various regions. Basically, it has been divided into various regions. Our region is included in Southeast Asia, the Southeast Asian region that is called as the SEAR. So we can look at the donation. It's very minimal. It is represented by the diamond shape, blue diamond shape, this one, it's very minimal. And the maximum being the European region where the maximum donation is happening. So it also gives us various the organ transplant donations, whether it's a brain death or the deceased in the DCD. So you can have the entire picture in terms of what you call the organ transplantation, and in terms of what is the proportions of for the deceased and living transplantation various regions. And as I said, we fall in this region, SEA, the Southeast Asian region. You can look at the deceased donor percentage is very minimal, approximately around 10 to 12% in our and part of the country. So if you come to our own country, as you know, our country is diverse in terms of the religious and cultural differences, and so also in the organ donation rate. You look at the southern states are very active in terms of disease donor transplantation compared to the north and northeast. And this is what is at a national level, which is that's called as the NOTO National, the NOTO is National Organ Transplantation Organization. So it has evolved over a period of years to maintain the registry. And last year, this data was released, and it has been said that around we have actually reached a landmark of crossing 15,000 transplantations in the last year. The majority being the live transplantation, and among the live transplantation was a kidney transplantation, which was maximally happened in the last year, that is 10,000. And deceased donor were only around 2,700. And they have also compared the various organ donations in the country in different states. And we are glad that we are #1 in the entire country. So total deceased donor transplantation last year were 904. And the heart transplant, because this I believe is the heart and lung transplantation group. So overall heart and lung transplantation last year was maximum to around 250 heart transplantation, and the lung transplantation is 138. So as I said, Telangana is #1 in terms of disease donor organ transplantation. These are the top 5 states in the entire country. And in terms of the overall disease donor transplantation as well, so Telangana has topped. 655 deceased donor solid organ transplantation, including the kidney, heart, lung, and the liver, followed by Tamil Nadu, which was supposed to be #1 a decade before, and followed by Gujarat and Maharashtra. So one of the important aspects which I have been told talk on is what are the responsibilities, of this regulatory authority. So I think, the important aspect of the disease donor transplantation program, or to that matter, any of the transplantation organization at a national level, the NOTO, or at the state level, the SOTO, is the regulation of the organ donation and transplantation. And it is runs on the basis of the act which is available, and which has first come in the year 1994. And the rule was based upon this act, which has come in 1995. After that, there have been several amendments in this act, the latest being 2011 Act and 2014, which have extensively covered or actually remain, the amended basic upon the latest requirement of the requirement at present. Now coming to our state programs, our state program is called as the Jeevandan. It was established in the year 2010. Actually, this is the GO which was released, and it has comprehensively covered entire the aspect, functionality of any of the disease donor transplantation program in the state, including one of the apex body committee, which is called as CTAC, and the health secretary is the chairman of that committee. So, I think this was the office which was inaugurated in 2012 at Nizamis Medical Sciences, which is in that office. And we have various verticals which looks at the software production, the website, which is unique in our state. And of course, the public education programs, we have the council of the training program which is happening regularly, and then the training program of the medical profession. So this is how the milestone which have evolved over a period of, I can say the decade has passed now. So it was started in 2010 with the erstwhile Andhra Pradesh, and 2014 we had a unique challenge of the state division into Andhra Pradesh and Telangana. So what fortunately we have taken that as an advantage to cover the smaller, the area with more focus and more dynamic program, and it has taken a leap after that. And we in 2020 we have actually achieved a landmark of crossing 1,200 donations. This is donation. And Jeevandan is trying to address all the aspect challenges with respect to a disease donor organ transplantation. So with respect to the neurologists and neurosurgeons addressing how the preparation is being done, and addressing the intensity in terms of optimization of the diffuse donor, and giving license to various hospitals, the government and the private hospital in terms of performing the disease or transplantation program. The policing and forensic, as we know that the most of the donations are happening from the brain death or the accident cases which the men from the brain death. And of course, most important and sensitive part of the organ aggregation, and of course, the public education programs, and the key person and the entire program is a transplant coordinator. So we do have the coordinator training program as well in our program. The first and foremost thing I would like to address the legalities of this program. So as I said, the first important aspect of this program, or the crux of this program is the declaration, brain declaration. There was a lot of the controversies, a lot of challenges to how to go about the declaration, though we have a guidelines, and then the Act has broadly, mentioned how to declare the brain death. So but then we had at a state level in 2014, it's almost a decade before, we had formed various committees, and then we have discussed about the brain death declaration. We have addressed what are the challenges with respect to implementing this program in our state, and we have addressed few of the issues, which was actually, there was gray zone in our act that how to go about the declaration, and what are the, particularly with respect to age of declaration, when to declare it, what are the the time gap between the two declarations with respect to age, and when to go about the ancillary, the test for the declaration of the brain death. So I think these three were addressed, and basically, there three requirements are there to, to declare the process of brain death. One is the irreversible coma, the second is the absence of brain death reflexes, and third is the apnea test. We also come up with the detailed, the protocol how to do apnea test as well. So I think this is how the apnea test is done. So I don't want to go up into the details of this apnea test, but you can just go through. It's available on our website. And the second challenge is going to go about the ancillary test, or what we call as confirmatory test. So whenever, mostly clinically, it should be decided based upon the apnea test only. There should be 2 tests done at an interval of 6 hours for the adults. And as the age decreases, the duration of the 2 domain declarations increases. So if it is below 18 years, it's a child. So it should be the difference between 12 years, 12 hours. If it is an infant, it should be like 24 hours. If it's a neonate, it should be at least 1 week before you call it as a neonate brain dead. So this is the time interval, and you should go for an answer test when in a situation when we can't go for an apnea test, particularly with respect to patient is very unstable and patient BP cannot be maintained, and it's very difficult to disconnect the patient from ventilator. You can go for an ancillary test. Or situations like road traffic accident where there is a severe chest injuries or the neck injuries, where it becomes difficult to disconnect the ventilator, we can go for the ancillary test. So this was actually laid down by the committee. We are following that also. In fact, few of the states have gone one step further in terms of making the brain death mandatory by the treating doctors. And if it is brain death is declared, in fact, when family members can be counseled about the brain death, and if they do not agree, even a few of these government, like Tamil Nadu was the first government to come up with those that particular geo. It was followed by Kerala in recent times, that is 2020, and then the Gujarat. As I said, Gujarat has gone one step forward, and had said that even the ventilator or patient can be disconnected, or they can be withdrawn from the life support if they do not agree for the organ donation, in terms of optimizing the resources available. But however, it is difficult to implement. I don't know how far it's being implemented. They have to take feedback from the future. How many important this GO would be in terms of increasing the brain deaths. The second part was the forensic, mobilizing the forensic people and getting the postmortem done during in the middle of the night during the organ donation. So again, we had a series of meetings with the forensic doctors, and we had formed a committee. They had come up with their own guidelines, and they have recommended that the postmortem can be done at any time, even after the 5 o'clock and in the middle of the night, at the time of donation at the hospital where donation is happening. This we have come up with this recommendations in 2014. But you might be aware that we only recently the central government has come up with orders that the postmortem can be done during the evening hours to promote the organ donation. But this we have done almost a decade before. So the other challenge what we have faced is that medical legal cases, and it was difficult for us to mobilize the police. We can convince them for the interest during the donation process. So we again had a series of meetings with the police people. We had come up with certain recommendations in terms of, conducting the inquest. By the nearest police station, it's difficult to mobilize, the police. Where the first inquest has happened, it happens only in the peripheries, and it takes time for them to come and do the inquest part, and by then the donor becomes unstable and we lose the organs. So we have come up with the recommendation that the nearest police station attached to the hospital they should do, and they should hand over all the formalities to wherever the FIR was done. And also we have requested them to go for what you call the creating a green corridors. And in fact, this was very impressive. This again has happened in 2014 and 15, almost a decade before. And they have come up with an orders to all the police stations to coordinate with to cooperate with the Jeevandan scheme and to conduct the inquest whenever it is requested from the Jeevandan office, and to go for the green corridors or clearing the traffic. And also they have again they were so cooperative that they are also included what they call the counseling part. They help us in the counseling of the donor families whenever they are attached to the family members, or they whenever there is some it belongs to their own constituent, their own area. And they have also been helping us creating an awareness. So these were the two programs which we have conducted to make them aware and make the public aware with the help of police personnel. And these are the we might be knowing very well that how cooperative the police people are in creating now the green corridor. So we have come up with a flow chart where there is a coordination of the government, particularly the police and the forensic. They both should coordinate. They come and then try to clear all the medical legal aspects of particularly before the donation. And these are the forms which we have developed so that all communication becomes easier and becomes authentic and becomes professional. That was a medical legal part. We have tried to address that, and we have tried to conquer that. And I think it's one of the I can say reason why our program has become one of the successful model for the entire country. The second, which is more sensitive part, which need to be addressed at the beginning of the program itself, and we have tried to do that in the initial part of the program, taking the help of whatever existing successful model then. So that is equitable distribution and the transparency in the organ allocation. So this is how we have evolved. So we have again formed the committees and their recommendations of the scientific recommendations of allocating the organs and making those allocating the points or the recommended guidelines into a software. So these are the PRP recommendations done by the liver committee as MEDSCO, the kidney, the REGISTRY system, and of course there is again a ROTA system has been suggested. So all this was transformed into a the online allocate registry. So as the crux of this today's program is making a registry. So I just wanted to emphasize that the another main point of success of our program is having a centralized registry for the patient as well as registration as well as the allocation of the organs and the subsequent follow-up. I think this is the unique for our state. I think first of its kind in the entire India for coming up with an online system for the registry and the allocation model. So this is how the patient are being registered here. And this is one of the registration, the process. The patient needs to be registered through the hospital. The hospital are given the credential. It happens to the hospital. And the basic, the demographic or the basic patient profile has been taken. And subsequently, it is followed by the whatever is the organ, the organ registration happening. So we need to have a scientific parameters for the organ to be registered, to be updated during the registration process itself. So that basing upon these points itself, the system can have this allocation policy which is inbuilt again in the system. So these are the few of the factors which is captured at the time of registering the liver transplant patient. And this is for the heart mandatory field for the heart transplantation registry, and this is for the lung transplantation patients. And that's how once the registry process is complete, we get a registration acknowledgement where the patient details are there, and patient can always call in the central office or the concerned hospital to look at their own waiting list. And we have the waiting list basing upon the whatever is scientific guidelines which is recommended. So as on today, we have the active list in our registry are around 3,000 plus, and if you can look at the maximum is with the kidney at 2,000 plus, followed by the liver transplantation. As you can see, there's not much of a waiting list for the heart and lung. I don't know how many patients are very active in this list, but if you compare to all the solid organ transplantation, heart and lung patients are little less. So we get this organ allocation basic upon the first is the hospitalized list, then it goes to the state-wise list, and then we share the organs to at a national level through ROTO and NOTO if the organs are being utilized in our state. And of course, the patient, the public can also pledge their organs, which is also available online. So the basic parameters are captured and patients given an organ donor card. Of course, there are few issues with the donor card, when like unlike the Western countries where the among these organ donor card is available, that is a legal document, and then we can actually use that the donor card as a permission to go for organ donation at the time of whenever unfortunately or fortunately patient is is in a deathbed with a brain death. But however, in India, that donor card doesn't have any legal significance. It's only been used as of now as a means of awareness, creating an awareness. So we have actually requested, few of our transport departments to link this with the driving license, and we also requested our government to link that with an Aadhaar card. But of course, it requires a lot of political policy making or decision making. So as of now, it's been available online in our site. It is, everybody can calculate their organ. And of course, we also conduct various awareness programs. Physically, we try to encourage the public and the teaching institutions, the schools to pledge for their organs. So everything is like now we are talking about the digital world or the digital India. So everything is online, and we have got a best award for this software in year twice, in year once in 2015 and recently in 2020 as well. So this is again an app where we can place the organs to app, and now we're trying to expand this to have the organ allocation also, to send the organ alerts, and then to have the organ allocation also through this app. So as on today, we have around 35 hospitals registered under Jeevandan program and actively participating in the organ transplantation program, the 3 hospitals being the government hospitals and 32 being the private hospital. And we also have this organ retrieval center. So this was one experience we had recently where the military hospital, which actually doesn't come under the territory of the state, it actually comes under the national the NOPA, but however, we have tried to help them in having their organ retrieval. This is the first organ brain death which was declared in military hospital and successfully they have donated. We have helped them in the entire process of identifying, declaration, and then trying to retrieve the organs and allocate the organs. Of course, as a state, we did not get any of the organ from this the hospital. As I said, another initiative by the Jeevandan, very important initiative is having the coordinator training program. So none of the universities or the states, they have a structured program for this the organ as a transplant coordinators. We have tried to identify these defects, and then we have tried to have our own program through a Jeevandan. So I think most of the hospital have this experience of coordinating with Jeevandan, having a coordinator training program. We have tried to train them both in theory as well as practicals. And we have in fact exit examination also at the end of the course, and we have trained around 500 people till now over the past 5 years. And in fact, recently also we have tried to include this in our own NIMS hospital paramedical course. We have tried to include as one of the certificate program in our NIMS. So I think next year or this academic year we are going to start this dedicated program. And this was one coordinator training program. Recently, last month we had in Kims Hospital, and that was one of the successful programs attended by around 80 plus coordinators. And this is how we try to give the certificates with the health minister and then the director of medical education and the director who are the chairman and co-chairman of our Jeevandan program. This is another very good initiative from the government, and I think most of the poor people have been benefited out of this program. So as there has been a myth that the organ transplant is only accessible to rich who can afford, and it costs around lakhs of rupees. But it's a myth now. It's not. It's no more a reality. The government has taken initiative to support the poor people and cover all this transplantation under REGISTRY program. And we have tried to coordinate with the REGISTRY and then put all the transplantation, including the heart lung transplantation, including the combined heart lung transplantation, also to be covered in the REGISTRY program. And we are happy that over a period of last few years, we had around 431 the transplantations, organ transplantations, various organ transplantations, including the heart and lung transplantations happening in government hospital free of cost under the REGISTRY program. And of course, there's like, there are a lot of, discussion going on about how to, support the donor families. As of now, we are trying to honor them with the health minister. Every year, we try to honor each and every donor. We call them and try to honor them. And of course, we are trying to help them in whatever existing the government policies are there in terms of whatever children education, all those things at the individual levels within the government scheme available schemes. We are trying to prioritize these donor families for these government schemes. And of course, the awareness or advocacy program, there is no end for that, and we can't achieve that overnight. It's been a continuous process. We are trying to motivate, the celebrities are trying to, mobilize all the resources to create an awareness and advocacy among the public, including the religious, because there are a lot of religious myths also. Because as I said, our India is a secular, and secular, and we have a lot of, all the religious representation in our India. So each religions have their own concerns and their own myths, and there are a lot of myths was there associated with one of the community. We try to address this through mobilizing the religious scholars, and after that, we did had a few of the donations from that particular community. And of course, this is one of the, I think, best initiative I can say, where we have sensitized the future, the coming generations with a single chapter in our 10th class state syllabus, which talks about the organ donation, including the brain death and the Jeevandan program. I think this is going to sensitize the next generation, many generations, about the organ donation without any active intervention. So this is very close to my heart. This is something like, which has tried to sensitize I can say people living in a very remote villages as well. It's called condolence program. We try to honor the donor family. We go to their villages, very remote villages, and we accompany them. And we also see that we try to mobilize the local leaders so that they get some credibility and they become, in the presence of their own villagers, and then they spread message, positive, message about the organ donation in the remotest of the village possible. These are the awareness programs or condolence programs which have been regularly conducting. And coming to our own statistics, our own registry, I think as you can see, there have been a gradual increase in the performance or improvement in the performance of organ donation in our state, except for the I can say 1 year where we had the whole world was hit with COVID. Now, of course, we have taken this as an advantage, and I think you all know that how the lung transplantation program has improved after the COVID period, and our Telangana was one of the, I can say, hub for lung transplantation, and people were flown, through air ambulances to our state for the lung transplantation. And post COVID also, we have picked up very rapidly compared to rest of the world or rest of the India, I can say. And we stood #1 in last year in terms of organ donation, reaching 194. I think with this year, we have already completed 115 donations, and with this phase, I think we are sure to hit the 100 mark in this year. And this is the overall the data. So I can say we had around 119. Yeah, this time will be going to touch the 2,000 mark for kidney transplantation, and liver around 1,000 plus liver transplantation. Heart transplantation are 180. And as you can see, lung transplantation has rapidly increased after COVID times, and we have reached, crossed the heart transplantation. Initially, there were only 20 to 30 before COVID. If you can see the data, 2018 and 19, hardly they were. It was in single digits. Only after 2020, we have rapidly increased the lung transplantation in our state. And of course, pancreas is very minimal. Overall, we have around 4,000 plus or solid organ transplantation happening through our program. So if you look at the donation rate, so it is calculated in terms of per million population. So the maximum you can see is in the Spain, it's touching around 50. But however, our India is around 0.5. Now it's reaching 0.8. It's reaching towards 1 per million population. Look at our performance in our state. It is 5.5 per million population. So almost I can say 10 times the Indian average. So that's how our performance has been. And when we try to compare the overall, performance, our state performance with the India country's performance, you can see almost around 20 to 25% of the overall organ donations coming from our state alone. So this is how we are trying to improve over the past few years. And the lung transplant, as you can see, almost last 2-3 years, we had a significant contribution of lung transplantation from our state. So last year we had around 47%, and before that 62% of the whole of the lung transplant of the entire country was coming from our state alone. And I mean, initially, I don't know whether you remember, so most of the transplantation, particularly when it comes to the world, it is through deceased donor transplantation, and live is only like, 10 to 15%. Reverse was there in with our, what you call India or Southeast Asian regions, it was 12.5%. But if you look at the Indian, comparison ratio proportions of live versus cadaver, so cadaver transplant is 34:1 compared to the live of around 60%. So that's how our diffuse donor transplantation definitely is trying to match up to the international standards. And of course, we are trying to network through ROTO and NOTO, so to improve the performance of the overall country. And we are glad to share that we have been helping our adjacent states, including the Karnataka. We have tried to share what the software, and then we have tried to share our model, including the Gujarat is supposed to be one of the closest to the Prime Minister. When Gujarat, we have tried to help build their program and then provide software. And now the other state, including the Orissa, recently 2 days before, we had a meeting with all the IAS officers across on entire state. So we had the Jammu and Kashmir bureaucrats, and then even the Lucknow approaching us for our model so that they can imitate our model, and then we are trying to improve their program. So we are trying to calculate at a national level, helping the other the states and then the nation at a NOTO. We are also trying to reach up to our districts level. So we are trying to open, the zonal centers and various districts. Now that the government is also very proactive and has opened various government the hospitals, teaching hospitals in each of the districts. So we are trying to transform these teaching hospitals, or the hospitals into medical colleges into a retrieval center initially, and slowly to government and convert them into a transplantation center. So we are trying to spread both ways at a national level, international level, as well as at a district level. So this is our milestone, and I think we have evolved as one of the success model, and I think always it's a teamwork. I really appreciate and thank all the hospitals, including the Yashoda hospital, who has been a very active and very supportive in terms of, and I think most of these the faculty are a part of various committee, including the organ the committee, the liver committee, liver subcommittees, and heart subcommittee, lung subcommittee, and they have been helping us in build these Jeevandan program stronger and stronger. Thank you very much. As I said, excellence is a continuous process. Though we have evolved as one of the a successful model and top in the country, but I think it's this long way to meet the requirement. There's still we are only trying to cover, I think 5 to 10% of whatever is the demand or requirement is. There's still 90% that is still there to travel forward. So thank you very much.
Wonderful, ma'am. Giridhar sir, anything to talk?
Thank you, ma'am. That's a very crisp presentation, and we had a whole lot of information. I know it's a very huge topic, but you've managed to cover all of it in quite a short time, and that's a very good presentation. Thank you so much, madam. I'll just briefly, for all the people involved, I'll just go through a few salient points that you have mentioned in your presentation, just as a recap. So we've seen the verticals in SOTO. We saw the brain death certification, which is been taken across states also. The police department coordination for inquest, especially in terms of medical legal cases, and of course their involvement for obtaining a green corridor. The organ allocation policies, and especially the patient registry. We've gone through the details of that, and how the wait list is organized in terms of hospital-wise list compared to the state list, and then it goes on to the national list. Then you also informed us about the donor card. Yes, right now you just said that there is no legal significance for this. Probably with the help of the government and administration, this can bring about a change in this, and that will be really helpful in terms of having a legal right for with respect to people owning a donor card. Then also you took us through the more later digital developments of Jeevandan app for the organ donations, and also the transplant coordinator training programs. The government REGISTRY coverage, which is really a very big help for those needy patients. which forms a large part of our population and who are always waiting for a lot of organs, various kinds of organs. This is like heaven sent for them when the government steps in for financial assistance, especially because we know that the transplant doesn't just end with getting the organ, but it goes on to the immunosuppression and also, a change in lifestyle for them. The earning capabilities also vary. So it's very good that the government has also taken initiatives for this. Then you also dealt with the donor family support, which is a very, very good initiative. And because what we do not understand once we get the organ is the amount of trauma that the family goes through. And I think that's a very big step and a very humane step that we should look into more detailedly and go forward with that. Of course, with regards to education, you have already mentioned how we are trying to bust certain religious myths and resistance to organ donation by educational programs, as well as inculcating it in the future generation by introducing chapters within the syllabus with regards to organ donation. And this goes a long way. We'll see these results quite later, but there will be very definite results because the younger generation, our children, who are more educated about organ donation, we don't really need to then think about where the organs are going to come from, let's say 10 or 20 or 30 years later. You also dealt with the condolences program, which is quite close to your heart, I believe, and that is a very good initiative. And we've also seen future plans, which are quite ambitious, and yet I think are very achievable under the guidance and leadership of individuals like you, madam. And I hope that we do see the light of day with respect to a lot of changes that you have envisaged for the transplant program. And of course, it's very heartwarming to know that Telangana state is standing top in most of the statistics. And I think that speaks volumes of effort from individuals like you, as well as the state machinery, which is involved in letting, coming across and coordinating and getting all this organized so that we have our numbers to put us at the top of the country. Madam, a few questions that I thought I can, if you don't mind, I'll just put across so that we have
whatever I could do, because I have a huge collection of data, and then,
yes,
depending on the audience, I just try to customize and put it across whatever time limit has been provided.
Yes, madam, and it's a wonderful job. Believe me, in such a short time and covering all these topics is quite impossible, and it's really appreciated. Madam, just for the record, do we have any data on what the regular waiting times for each organ would be?
Yes. I mean, everything is been like it has evolved over a period of, it's been a decade now. So we have, tested, it's a time-tested model. So we are trying to, upgrade that whatever the requirement is, it's there, demand is there. We try to, evolve that in that direction. So we can just take out the data that what was the waiting period in each of the the transplantation. So average, I can say it varies with organ to organ. So average waiting time for the kidney is around 2 to 3 years, because there's a huge list. And then followed by the liver. Liver is around 6 to 1 year. And of course, heart and lung is not much waiting period. It all depends upon the match. Most of what happens is not like patients are there, recipient is there, donor is there. It's just, you need to have perfect match. So because of the mismatch, they're not able to utilize the organs.
Right, that's very nice to know, because just going through the international data, was just reading up, and for heart, even in a very advanced nation like the USA, their waiting time is just about 55% of them get the heart in 1 year. And for lung, it's even worse. For a single year lung, it takes about 2 years to reach the same amount of percentage. For double lung, it's even worse, 3 years. So I think we're doing far better than them. Of course, it's too early to say all that, but yes, we are on the track to become, one of the better nations who deals with organ transplantation.
But this actually, we can reduce this waiting period when all the states are performing uniformly across the India.
Yes,
so,
yes.
There's a burden on these performing states only. And now that the government is talking about the one nation, one organ allocation. So they will, domicile statement is gone now. So people would like to, register in multiple places and the huge waiting list. So I think if all the states can, perform uniformly, so I think we can address this, and then we can reduce the waiting list as well, waiting time as well.
Madam, do we also have any data with respect to life expectancy after a certain organ donation transplant, after a transplant? Like how long does a heart donation patient
No.
live for?
Okay, so that was little challenging for us because during development we have tried to developed over a period of in a stage manner. So recently we have tried to develop the follow-up part also. So we are trying to emphasize that the follow-up is done by all the hospitals and the organs so that we can actually work on what is the life expectancy. If we have a data, so then probably we can actually talk about that. So I think.
Right.
There's a little challenge about collecting the follow-ups. We are trying to be a little strict in casing in getting the follow-up part also. So, but on an average, what I can see with what our existing data is, the liver transplants, I mean, the kidney and liver transplants have been doing very well. So initially it was little because again, all depends upon recently I was just trying to look at the how we are trying to utilize the organs with respect to external criteria. So initially we always used to have the standard criteria donor, only then we used to accept and then do work. So even the organ transplantation outcome also will be good. But now as the program is evolving, we have become more confident, we have expanded our donor pool. So we get a marginal donor as well. So in fact, rather than improving their survivals, it has little dropped. So I was looking at why, what is the reason? So we are trying to expand our donor pool. We are actually trying to use the marginal donors and optimize optimize the organ utilization. That process somehow we are not able to translate that into better outcomes. Probably this with experience will do that also. But coming to heart and lung, there's not been much of what we call when compared to the liver and kidney. I think survival is definitely less, but I mean definitely it is improved with increasing expertise and more number of transplants happening. Definitely is likely to improve. The outcomes are likely to improve.
Like I said, ma'am, probably there's a large mismatch at present with respect to the number of donors and the number of recipients, which is why there's a mad rush to at least get some organ, even if it is marginal, marginal kind of indication of the donor, and that probably is affecting our results. So probably, pardon, madam.
It would improve with experience.
Definitely, with expertise as well as increasing the number of donor number, so that there is a less disparity between the number of patients waiting for the transplant and the number of donors. And I think we are heading that way because we have a lot of educative programs, and also people are getting to know more about it, even through the help of celebrities. So probably, in a few years down the lane, 5 or 10 years, we should have more donors and less amount of mismatch between the donor and recipients. Madam, one thing, because in this digital age and a lot of data privacy and all that, so probably, patients who are wanting to register on the donor, become part of the donor card program, they might be thinking, how secure is their private information on the Jeevandan, website when they register for organ donation? So to that extent, do we have some sort of, measures taken to assure patients? Because in the present day, that's what they are more bothered about.
This is a very appropriate question now that we have listened to so many stories with respect to the personal data.
Data loss and data theft.
Large, well-established the organizations. And but I think, as far as Jeevandan is concerned, it is with the government NIC. The whole of the website or all of the data is being managed by the National Informatics Center. It is central organization, and it has been very secure. So it's like very secure. And then there's the reason why initially we had proposals with a lot of organizations for the development of this website, but we opted for the government. It was difficult for us to get everything done. But of course, this being central government organizations, data is very secure. As with Aadhaar card is also something like that. It's a government, government is providing that card to you, and we have whatever basic information is there. Their Aadhaar. Those are being used. It's like something beyond that, they're asking for any personal information or something beyond which is not to be shared. So whatever is there in the public domain in the Aadhaar card, only those things are being asked. And of course, this is being managed by the central government. It is very secure.
Right. So Dr. Chetan, Dr. Ravikanth, if you do think there is something else that you can add or something else that you would want to ask, including Dr. Manjunath and the others on this forum, I think this is the best opportunity to, get Madam to give us more information, probably because she's the best person to tell us anything that we want with respect to organ transplants.
Very good evening, Madam. I'm Dr. Chetan. I'm the transplant pulmonologist at Yashoda Hospitals. First of all, I would like to congratulate and also thank you for whatever you've been doing in Telangana, because it's very official that Telangana has the highest number of donations in the country since quite some time. So all credits to you and thanks for that. And second thing, as you said, the condolence program that is very close to your heart. And I also follow that on Instagram every time. And whenever you post that, it's quite heartwarming to see that kind of gesture from an organization to the donor family. So one question that I have, I don't know how this goes, but how do you see at DCD donors in our country? Is that a possibility or it's just a dream for us?
No, I think DCD, we have not reached the stage of getting into DCD. First and foremost thing, there is no clarity about, when to go for a DCD, particularly with respect to, there is something like the two important aspects. We have a controlled and uncontrolled, the DCDs. We have different types of, the DCDs. So basically, uncontrolled we can never have, because our system, health system, we can never, retrieve the organs from a patient who has all of a sudden come to a hospital with cardiac arrest, resuscitating.
I think we've just lost Madam's connection.
I think DCD takes a long time unless we have a legal implications and need to discuss a lot about this in the parliament. So.
Sorry, I think there was some networking. Audible now?
Yes, Madam. You're audible.
Okay, so we're talking about the DCD. I think we have not reached the time where we can consider, because we need a legal clarity before we can proceed. If there's an our health systems are not adequate enough to resuscitate the patient and get the organs retrieved. And second thing, even in a controlled DCD, what we need is euthanasia. Because whatever practice is being followed in the Western, so what they do is in ICU, patient is being managed, and we know that patient is not going to survive, and then they go for they ship the patient to OT and go for euthanasia, controlled. So I think there is no concept of euthanasia accepted, in India, and there's also time where we have to wait before we can go for organ retrieval. That's what is the time, no touch time. So it varies from 5 minutes to 20 minutes. So there's also no clarity about this time. So unless we address these things, I think first we need to address before we start considering about the DCD in our country. But there is a lot of scope for DBD. So if we can tap all DBDs, I think we will have enough organs, not only for our country, but to give it to others in all our neighbor countries also. So I was just looking at the statistics of for the now called road traffic accidents. So we have around 5 to 6 lakh accidents per year, and among that, around 60.
I think the connection is lost again.
Madam, we couldn't hear you for the last minute or so. You're not audible. Could you please unmute yourself, madam? Yeah, thank you. Thank you, madam.
I'm extremely sorry. I think we have some networking issue. That's why I'm getting disconnected repeatedly. So I don't know where I could not be online, but I think we need to address these legal issues before we can go for a DCD. So that's what I was telling.
Ravikanth sir, any inputs that you would like to give?
I think, for a wonderful program like this, ma'am has taken a lot of pains to make it into a good online track. And I think still a lot of education is needed in this aspect for the patients to overcome, like, their beliefs and everything. I think we can increase the number of donations and make this program more successful. What is it, Chetan?
Exactly.
I think we have a lot of potential here, and like if when doctors start, like we have a education series of the patients and all, good coordinator, like ma'am is guiding all these coordinators education right now. I think every hospital is going to have a coordinator. I think the number of donations will definitely increase further.
And yeah, madam, we are always ready to be a part of all these awareness programs. If anytime you need us, we are there.
Yes, thank you. So I think, all of us should come together. It's not like individuals or, the government or individual hospitals. So all of us should come together, work together to reach that goal.
True.
It's
Yes,
not like one nation or an organ donation. It's something like, no waiting list for me.
Yeah.
No. Zero
Yes,
waiting,
ma'am.
zero waiting list.
Yes, ma'am. So,
Thank you, ma'am. Thanks a lot for coming and giving your valuable time to us. Thank you, Giridhar sir. Any other questions, Chetan?
No, that's it.
Yeah. Thank you, ma'am. Thank you, sir. Yeah.
thank you, madam. Thank you so much.
Thank you for
Thank you,
being-
Ravikanth sir.